February is Heart Disease Awareness Month. Heart failure is something many of us had to or will have to deal with within our family, but it's something that can be proactive about. St. Mary's is hosting a heart-to-heart event next weekend, and here to tell us all about it is cardiologist Dr. Alan Singer. Thanks for being with us today.
Thanks for having me.
Is there a difference between heart failure and a heart attack?
Yeah, heart attack is damage to the heart muscle from a closed blood vessel to the heart, and that's one of many causes of heart failure. Heart failure is due to poor function of the heart and fluid backing up into the lungs and tissues.
So a heart failure, that's not a death sentence by any means?
Nope, no it's not. Many people can live just fine with heart failure as long as you get it treated.
And how do you treat it?
Well, it's a number of things. One is removing the fluid from the heart, and one is looking for the underlying cause of the heart failure and trying to fix that cause.
And what are some of the major causes?
Major causes include heart attack. There can be intrinsic problems with the heart muscle. There's valvular heart disease, a whole number of different things that can cause heart failure.
And I assume there are things you can do to prevent this in the first place.
Yep, prevention is the first line of therapy, but you should make sure to see your physician and get your cholesterol checked, get your blood pressure checked. A good diet, exercise, all those things can prevent heart failure from happening in the first place.
And how can a family member help if somebody else has this?
Well, the first thing is recognizing the signs. If your family member is short of breath, if they're getting swelling, all those things are signs of heart failure, and they should see their physician.
Swelling of the legs?
Swelling of the legs is the most common.
And tightness in chest?
Tightness of chest sometimes, but shortness of breath is the major symptom that people have.
Okay, there's a big event going on next weekend. What's going on then? What are people going to be able to do?
Next day, there's going to be a whole big educational program about congestive heart failure, and there will be lots of people to meet and things to learn about congestive heart failure, the signs and symptoms, and what you can do to prevent it.
Are women more affected than men?
Both women and men can be affected by congestive heart failure. Women tend to get it at an older age. But both women and men are equally affected by congestive heart failure.
And it can strike anyone. It's not just if you smoke or eat too much meat or don't exercise.
No, all those things are risk factors, but anyone can get congestive heart failure.
All right. Well, Heart to Heart, Living Well with Heart Failure is next weekend, February 18th from 9 to noon at St. Mary's Hospital Conference Center on Park Street. Pre-register right now at our front page, channel3000.com. Again, it's free, but space is limited. Dr. Singer, thanks for being with us today.
Yeah, thanks for having me.
And we'll be right back with the final check of your forecast.